Hi, I'm Dr. Jeeves Vijay Surya. I'm a GP in East London, and I'm also a clinical advisor to the vaccination programme at NHS England.
Hi, I'm Dr. Hina Trivedi. I'm a GP in Leicester. I'm a lead and a mentor for diabetes, and I also am a teacher at the university.
Do you have any advice for families who are worried about their children getting winter viruses, as this is the first winter without restrictions since the outbreak of COVID-19?
We know that vaccines are the safest way that we can train our immune systems to fight off viruses and also to stop the spread of these viruses to our loved ones. Even if you've had your flu vaccine last year, you need it every year because the viruses that can cause flu change every year. We know that COVID and flu circulate most during the winter period, and whilst for most people it's an unpleasant but mild illness, for some patients this can be really, really dangerous and even life threatening. If you catch COVID and flu at the same time, this can really increase your risk of serious illness and of harm. The NHS has already invited those of us at highest risk from COVID-19 and from flu for an autumn COVID-19 booster and flu vaccine. All children aged 2 or 3 years old on the 31st of August 2022 and children that are 6 months or older with a long-term health condition can get their flu vaccine at their GP surgery. All primary school aged children will be offered the flu vaccine through the school or through a community clinic, and all parents have to do is sign a consent form for this to happen. All secondary school aged children as well in years 7, 8 and 9 are being offered that flu vaccine. Now, it's really important to say that the flu vaccine is a quick and painless nose spray. Your child can be offered the flu vaccine injection if the spray isn't suitable for them, but this is a really easy way to provide vaccination for our children.
So, there are lots of other winter illnesses, and to reduce your risk of catching them, there are a couple of things that you really should do. So, firstly, encourage children to wash their hands properly with soap for at least 20 seconds and use a tissue to catch your coughs and sneezes and keep away from others when they're unwell. Also, use nhs.uk for information to help you look after children with mild illnesses. Parents are really worried at the moment about an increase in scarlet fever and group A strep. So these are the things that really you should think about and keep in mind. Scarlet fever and strep throat will make children feel unwell, but they can be treated with antibiotics. So if you're worried about this, please visit nhs.uk or contact 111 online or your GP surgery if your child has any symptoms of scarlet fever or strep throat. And these symptoms are such as fever, sore throat, swollen glands, difficulty swallowing, and headache. Scarlet fever causes a sandpapery rash on the body and a swollen tongue. So just be careful about any of these symptoms. And if your child has any of those, please contact your doctor as soon as possible. The other thing to bear in mind are the grave complications of streptococcus. This is what we call invasive group A streptococcus. You may have heard this in the media, IGAS. Now, these infections are very rare, but it's important that you speak to a healthcare professional if you feel that your child is getting worse after a bout of scarlet fever. So you'll have to look out for signs such as fever, a fever that won't go down, or dehydration, or extreme tiredness or vomiting, intense muscle pains, or difficulty breathing, or breathing very fast.
How do we know what vaccinations our children should have had?
You can look at your child's digital health record, the Red Book, or you can always ask your GP practice to check if your child is up to date with their routine vaccinations. Some vaccinations and immunizations are given in the community, such as those that we give through the school-aged immunization service. So, for example, between 12 and 13, we offer all children the HPV vaccine to protect against some of the cancers that we know are caused by HPV. By the time our children leave school, they will usually have been offered vaccinations against 18 different potentially life-changing diseases or infections. If your child has missed any of those immunizations, such as the MMR, you can ask your GP practice about how to rearrange this as soon as possible.
The pandemic has had a huge impact on our children. If we're worried about their development, what can we do?
Your child's digital health record, or Red Book, contains information and guidance about developmental milestones. If you're worried about your child's development or behavior, whether you think the pandemic has been at play or not, you can always talk to your health visitor, to your child's school, or to your GP practice.
One thing that struck me today is how much support there is available and where to go. Please, can you tell us which services are available and when we should use them?
That's a really good point. There's a lot in the news right now about the NHS being really busy, but you know, your NHS is here for you and your family. You must get help when you need it, and please don't wait till something is urgent. So you can do a couple of things. You can talk to your local pharmacy for advice about minor ailments, such as mild symptoms or your existing prescriptions. You can also contact your local GP practice, as most of us know, for most of our preventative needs, pregnancy, physical and mental health advice. Then you can also go to a minor injuries department for help with things like cuts and sprains if you've had a minor burn or a strain. I think we all know that we can call 999 and go to our local A&Es, but it's really important that we try and use these other services before you go there. But if you have a serious or life-threatening condition, absolutely you should call 999 or go to the A&E. Then there's also the free NHS 111 service. You can either call them or go online and you can get advice about minor illnesses or book an urgent appointment with the right health provider. And then remember, getting help from the right service means that you're seen much more quickly by a skilled professional who can get you the treatment that you need.
You can find more information about eligibility or how to book your vaccine at www.nhs.uk/winter vaccinations.
So, thank you so much for joining us today. That was incredibly informational and educational. Dr. Jeeves and Dr. Hina, thank you so much for joining us.
Thank you so much for having us.
Yes, thank you.